Hi guys, welcome back to my channel. I'm Ishita and I'm a psychologist. And today we're going to talk about the difference between a psychologist and a psychiatrist. कैसे इनका एजुकेशन डिफरेंट होता है, किस तरह से एक साइकोलॉजिस्ट ट्रीट करता है एंड किस तरह से एक साइकाइट्रिस्ट ट्रीट करता है. What kind of disorders do they treat? Basically we'll cover all the differences so you can figure out which one to reach out to. There are various kinds of mental health professionals. इसमें आते हैं ऐसे प्रोफेशनल्स जो लोगों को मेंटल हेल्थ सर्विसेज प्रोवाइड करते हैं. These are psychologists, psychiatrists, clinical social workers, counselors, clinical psychologists, and so on. The biggest confusion, however, remains between psychologist and psychiatrist. Let's talk about their education first. A psychologist is someone who has a master's or a PhD in psychology. यहाँ I also need to mention clinical psychologists जिनके पास एक MPhil होती है. On the other hand, a psychiatrist is a medical doctor. Like all doctors, they complete their MBBS first and उसके बाद वो specialization में psychiatry करते हैं. Now for training, psychologists receive considerable amount of training in various kinds of assessment. But एक psychiatrist के लिए ये training सिर्फ एक behavioral और cognitive assessment तक ही limited रहती है. Now, the way of treatment also differs for a psychologist and a psychiatrist. Suppose a patient shows up जिसको anxiety issues है. एक psychologist उसके anxiety issues का reason जानना चाहेगा, उसकी personality और lifestyle में changes लाएगा so he can cope up better. उसकी situations change करेगा. But for a psychiatrist will prescribe medication जो उसके symptoms control करेंगे. जैसे एंजाइटी के सिम्टम्स है palpitations, increased heart rate, difficulty in breathing. इन सारे सिम्टम्स को मेडिकेशन कंट्रोल करती है. Whereas for psychologists, they treat mental illness with various forms of therapy. कैसे हम वो ट्रिगर्स कंट्रोल कर सकते हैं जो बार बार उसको एंग्शियस करते हैं, एंड कैसे हम एक इंडिविजुअल की पर्सनैलिटी और लाइफस्टाइल में चेंजेस ला सकते हैं to make him see the world differently and not in a negative light. Specialization. Psychiatrist का main focus होता है mental disorders पे. They might specialize in traumatic brain injury, addiction psychiatry and so on. But एक psychologist different fields में work कर सकता है. They don't always have to work with mental disorders. They can help in coping with life stress, interpersonal issues. They can also work in various other kinds of fields जैसे organizational psychology, sports psychology, forensic psychology and so on. So now you know the difference between the two. So what's next? Who should you pick? In case of severe mental health issues जैसे schizophrenia, severe depression and autism, medication is necessary. दवाइयाँ लेनी ही पड़ती हैं because the patient needs to be stable enough कि वो therapy ले पाए. For less severe patients, medication for managing symptoms and therapy for understanding the root cause of the problem and fixing it works wonderfully well together. And for very mild cases of anxiety and depression, सिर्फ therapy लेना भी काफ़ी होता है. So if you feel आपके symptoms उतने severe नहीं हैं, go see a psychologist first. If they feel that you need medication, they will refer you to a psychiatrist. फिर आप regularly meet करोगे अपने psychiatrist से to discuss your medication and you will take therapy from your psychologist. Don't get me wrong here, there's nothing wrong with taking medications if you need them, but do not neglect therapy. They're supposed to work together.